Story 1. Taking antibiotics for a common cold is inappropriate. Colds are caused by viruses and antibiotics kill bacteria. This practice drives me insane and has contributed to our problem with antibiotic resistance. Story 2. They show someone being shocked when their heart rate is a flat line. This always happens in television and movies. When there is no heartbeat, there is no rhythm to shock. You have to get the heart going first. It drives me crazy, laughing out loud. Story 3. Period pain severe enough to affect your day-to-day life is not normal, and treatment should be sought and given. Story 4. Hospice does not kill patients. They are already dying. Hospice keeps them comfortable. Story 5. People sometimes think that if someone has a fever, they should not have a blanket because it could make the fever worse. The person feels awful, and a blanket will not hurt. Story 6. Suicide myth. People who talk about killing themselves will not do it. Suicide reality. Most people have told someone their feelings beforehand. Suicide myth. An attempt that did not kill someone does not mean they were not really trying. Suicide reality. Many very serious attempts are stopped by others or by chance. Do not ignore suicide. Get professional help immediately. Story 7. Some people say hospice care is giving up. I am tired of hearing family members insist that their loved one is a fighter and would want every possible intervention, even when there is no realistic chance of removing the breathing tube because the lungs are mostly cancer rather than healthy tissue. Quality of life is more important than quantity of life. Talk to your loved ones now, not when something happens. Discuss not only worst-case scenarios, but how far they want to go if they start to lose quality of life or independence. Ask specific questions. What do they want if they cannot eat anymore? What do they want if they lose the ability to do what they love? What do they want if they can no longer live alone or if their memory starts to fail? You do not want to make those decisions for them when your loved one is in the intensive care unit and emotions are running high. Story 8. Myth. Eating perfectly and avoiding vices such as smoking, drinking, and excess sugar will ensure you do not get cancer. Reality. Cancer is not so simple. Someone who smoked heavily for more than 50 years might never develop lung cancer, while a health-conscious relative who never smoked might. Smoking increases the odds of developing cancer but does not guarantee it. Myth. Pharmaceutical companies are withholding a cure for cancer. Reality. Cancer is not a single disease but many different diseases that share the basic features of uncontrolled cell division and failure of normal cell death. Each cancer is different and has varying symptoms, so there is no single universal cure. Some cancers are easier to treat than others, and outcomes depend on factors such as patient age and tumor genetics. A patient who was in remission may still relapse. If a universal cure existed, pharmaceutical companies would have strong financial incentive to sell it rather than hide it. It is implausible that companies would withhold a cure, since they profit by selling effective treatments such as chemotherapy, radiation therapy, bone marrow transplant, and other therapies. You cannot always prevent cancer. At any given time, people may have a small number of abnormal cells, but the immune system, including natural killer cells, usually eliminates them. Cancer develops when immune surveillance fails and abnormal cells proliferate. Reduce your risks through healthy behaviors, but understand that these measures do not guarantee prevention. Story 9. Just floss the night before your hygiene appointment. They will not know you have not flossed in 6 months. Yes, we will. Story 10. I work in mental health care. Borderline personality disorder is not bipolar disorder. Neither condition means simply being moody. In the United States, psychiatrists, therapists, and psychologists are different. Some psychologists provide therapy, but not all therapists are psychologists, and not all psychologists are therapists. Story 11. A do not resuscitate order does not mean do not treat. It means that if your heart stops beating, we will not perform chest compressions or cardiopulmonary resuscitation in an attempt to restart it. It does not mean that we will withhold other treatments or supportive care provided up to that point, and we will care for you to the best of our ability. The same applies to end-of-life care. End-of-life care can be comfortable and much less traumatic than attempting every possible intervention. People die. Sometimes allowing a natural death is the kindest choice. Story 12. This may seem unusual. I work in cancer care in an area with a large Amish population. They get cancer like the rest of us, but they are preyed upon by homeopaths and unscrupulous practitioners. Many Amish patients choose to work with our doctors. Many others go to Mexico for treatment that consists of herbs and unproven remedies. They either die there or return having delayed care so long that only palliative treatment is possible. It is starting to turn around. Having seen family members suffer after going to these places, the younger generation is coming to us and continuing care. Story 13. That menopause is just when you stop having periods ignores what we know about perimenopause symptoms, which can start for women as early as their 30s. Claims that hormone replacement therapy causes cancer and should therefore be avoided for women who have stopped menstruating are misleading. There are at least a dozen other myths about menopause. Story 14. Applying hydrogen peroxide directly to wounds is harmful. Plain water or mild, diluted soap and water are better. Story 15. The left brain/right brain theory is misleading and has been disproven. Story 16. Experiencing hallucinations does not necessarily mean you have schizophrenia. Many different conditions can cause hallucinations. Also, obsessive-compulsive disorder is not limited to checking doorknobs or counting. Story 17. The claim that we only use 10% of our brain is false. We use our entire brain. Story 18. A person with a concussion needs sleep, but they should be checked periodically to ensure they have not lost consciousness. Loss of consciousness can indicate a brain bleed and requires immediate medical attention. Story 19. Green mucus indicates a bacterial infection. Yellow mucus indicates a viral infection. Unless it is red or brown, the color tells me nothing. Story 20. Nurses are stewards of medical knowledge. I know a few who are strongly anti-vaccine. Story 21. That wearing glasses will make your vision worse. Or, conversely, that not wearing your glasses as prescribed can make your vision worse. Neither of these statements is true. If your vision worsened, it would have worsened regardless. This is driven primarily by genetics, growth, systemic health, and we are learning more about environmental influences such as vitamin D during childhood. Often your vision did not actually get worse. You simply experienced corrected vision and became so accustomed to it that your uncorrected vision feels worse than before. Like upgrading to an ultra-high-definition television and then going back to a standard definition screen after a year. The quality did not change, but your perception of it did. Story 22. Television portrays a 90% survival rate for cardiac arrest. In reality, survival is closer to 10%, and that does not account for cardiac and neurological damage that can disable a person. We need to be better at helping people and stepping in when needed to improve survival rates. Story 23. I hate exposure myths. Not wearing a jacket in cold weather will not give you pneumonia. Going out with wet hair will not make you catch a chill. Sleeping with a fan blowing on you will not make you sick. We are not weak Victorian children with consumption. Viruses and bacteria make you sick. Let's talk about hand washing, people. Story 24. All nurses and caregivers are smart, hardworking, and care about their patients. Story 25. People think that going to the emergency room for a non-emergency instead of seeing their primary care provider, or calling an ambulance for the same reason, will get them seen by a doctor faster. I cannot count how many calls I ran that were like this. Story 26. I'm allergic to iodine. No, you are not. You are allergic to an iodinated product, such as iodinated soap or an iodinated contrast agent. You cannot be allergic to elemental iodine because the thyroid uses iodine. You are allergic to the soap or to the carrier molecule in the contrast agent. Story 27. Not knowing the difference between cardiac arrest and myocardial infarction, meaning cardiac arrest is when the heart stops and myocardial infarction is a heart attack. Story 28. Air bubbles in your intravenous line aren't going to do anything. The entire length of the intravenous line can't even hold a problematic volume of air. If the argument persists, I tell them how we test for a patent foramen ovale. Story 29. Digression from veterinary medicine. The social media marketing campaigns for boutique pet foods have seriously affected people's perception of generic kibble. It is fine to feed your dog a standard science diet adult kibble, and it has been remarkable to watch how advertising has changed public perception even over the last 18 months. Story 30. A radiograph may or may not show the cause of your pain. Pain cannot be seen on a radiograph. Story 31. That your own research should be trusted over clinical guidelines backed by actual evidence. Story 32. People think cold medicine treats the cold itself instead of just the symptoms. Story 33. Zero sugar is good for you. Non-fat is good for you. Some sugar is beneficial, just as some fats are beneficial. I weighed 300 pounds at one point. Story 34. Some people still think vaccines cause all sorts of unrelated issues. It's amazing how persistent some myths are. Story 35. The healthcare industry is hiding a cure for cancer so pharmaceutical companies, oncologists, and others can keep raking in money by treating it. Story 36. Chronic back pain is a sign you are damaging your spine, and you should avoid exercise. Story 37. These comments are general, but there are no absolute fixes in medicine. Many patients believe that treatments and cures are perfect. The reality is that there are almost always trade-offs and side effects. Do not get me wrong. Some treatments are excellent. In my experience, however, it is usually better to focus on preventive health to avoid ever needing surgery or medication to solve a problem. This is a tangent, but I have to add keep moving. Stay active. I have seen many patients who look like they are in their 60s but are only in their 40s, and 70-year-olds who look like they are in their 50s. Those patients almost always stayed active. Story 38. Veins do not roll. You likely had an inexperienced phlebotomist. You do not want the doctor to draw your blood because doctors are often the worst at venipuncture. The best at drawing blood are pediatric nurses, anesthesiologists, and geriatric and oncology nurses. Story 39. Some people say that nurses care about patients while doctors are only trying to get rich from pharmaceuticals. Not that nurses do not care, but the idea that the doctor is the evil chief executive officer while the nurse is the one doing everything is misguided and frustrating. They have different jobs on the same team. Story 40. After surgery, get up and walk. The wound will not open. Story 41. I didn't break it. It's only a fracture. As if a fracture were a milder form of a broken bone. There is no difference. They are synonyms. Story 42. The idea that if you are in a car crash you must immediately get out of the car is only true if there are obvious signs of fire. Otherwise you risk further injury and causing another accident. One medic I know stopped someone at the scene from trying to smash through the windshield of a crashed car to reach the driver. The driver had internal decapitation. If the person had succeeded in pulling him out, he would have died. Story 43. When hospice is called in, it does not always mean the person will die within hours. Sometimes hospice is called and a person lives for another 5 years. Story 44. An ambulance ride does not guarantee you will be seen first. Triage is still based on how critical the patient's condition is. Story 45. We want you to do everything possible to save our baby. Although it sounds compassionate, it can be harmful. Sometimes babies are incompatible with life. Attempting every intervention can cause additional suffering and may result in a quality of life that is not life at all. Think carefully before saying this to clinicians and make sure you understand what you are asking. Story 46. Your blood is not blue until it leaves your body and is exposed to oxygen. Story 47. Saying that exercising during pregnancy is equivalent to harming the baby is incorrect. There are conditions that warrant bed rest, and it is important to be aware of safety. For example, do not go horseback riding without prior experience. On that note, at 6 weeks postpartum, you are okay to continue where you left off. Story 48. Saying that taking vaccines makes you a sheep bothers me. I hate that crap. Story 49. Urine is sterile. Gloves and hand sanitizer are better than actual hand washing. Story 50. You will not catch a cold simply from going outside in the rain without proper clothing. A cold is caused by a virus, not by the weather. In colder, wetter months you may be more susceptible, but you still have to come into contact with someone who is sick. Story 51. When your providers do not give the results you expect, that does not mean they did nothing. Stop requesting tests or treatments we have explained are unnecessary or cannot be provided. Antibiotics do not treat viruses. Immediate X-rays are generally not warranted for injuries that occurred months or years ago and would have already healed. Urgent care clinics are not the appropriate place for loss of consciousness after a head injury or for high-speed motor vehicle collisions. Emergency departments are not for colds or for obtaining a doctor's note to renew a medication for a chronic condition. If you can drink water, you generally do not need intravenous fluids. Story 52. You have to grab someone's tongue during a seizure so they don't swallow it. Story 53. This is not about human healthcare, but my mother's whole side of the family believed that feeding a pet a garlic clove would get rid of its fleas. It turned out it actually killed the pet. They still refused to believe they could be wrong. Story 54. I needed emergency surgery but was not insured. The hospital canceled 93% of my bill and put me on an 18-month payment plan. That is what they do for people who cannot pay. It was much less than I would have paid for the silver plan. I was better off than if I had been on an Affordable Care Act marketplace plan despite the myth to the contrary. Story 55. Many people aged 90 and older are designated full code. Please educate yourself and your loved ones about the realities of resuscitation. Story 56. Please stop putting things in unconscious people's mouths. This includes water and juice. Story 57. There is a belief that a significant majority of people who use social programs, such as the Supplemental Nutrition Assistance Program, disability benefits, Medicaid, and the Special Supplemental Nutrition Program for women, infants, and children, are simply taking advantage of the system, do not truly need assistance, and are taking it away from others. I assure you this could not be further from the truth. I have worked with this population for years and can count on fewer than 5 people who were exploiting the system. Many people are seriously ill or have mental health conditions, and it is very difficult to obtain income if you cannot maintain employment. Story 58. The idea that boosting your immune system is a good thing, along with 999 other so-called wellness tips, has no basis in science. Story 59. My parents' biggest annoyance was the number of people who thought they had to leave the doctor's office with some kind of medication for everything. People always wanted antibiotics for common colds. The real problem was that many doctors prescribed them, so bacteria became resistant and patients believed the medicine had worked because their colds resolved on their own after a few days. Story 60. I get sick every time I'm around someone who has been vaccinated. It's them shedding the virus. I'm just really sensitive to it. They're going to have a real problem in a few years with cancer caused by the coronavirus disease 2019 COVID-19 vaccine. Mark my words. Story 61. Working in the breast health industry, mammograms cause breast cancer. It is not that much radiation, and it has been tested and approved worldwide. The benefits outweigh the risks. Story 62. Robert Francis Kennedy Jr. actually knows what he is talking about. Story 63. Mental health problems are caused by faulty neurotransmitters and need to be treated with only medication. Story 64. The term blood thinners is commonly used to refer to anticoagulants. Anticoagulants do not thin the blood. Instead, they inhibit clotting by blocking the activity of clotting factors and platelet function. Story 65. Some people think oxygen is harmless. Respiratory conditions are very complex to treat. Oxygen will not help unless the patient is actually hypoxic. I cannot give oxygen to a 90-year-old patient with severe chronic obstructive pulmonary disease. It can precipitate respiratory failure and death. Story 66. What kind of vitamins do you suggest I take? Sorry, you won't fix 60 years of treating your body like crap with some random vitamin. Once you see me, you're likely at the start of your downward spiral. Story 67. This is not a myth. I hate when people who are supposed to be performing cardiopulmonary resuscitation are merely giving a gentle chest massage. Compressions should be deep enough to risk fracturing ribs, and it would look more realistic. Story 68. My wife is a nurse and believes that being in cold weather gives you a cold. She has been a nurse for 18 years. Story 69. For gunshot wounds, it is not always necessary to remove the bullet. I have had arguments with patients and family members who insist we should always perform surgery to remove bullets, even when removal could cause more harm. Story 70. People shame my elderly friend with type 2 diabetes for eating rice or sugar instead of discussing carbohydrate counting and absorption rate. Story 71. Wet hair gives you a cold. I have died on this hill, and it was not even that long ago. We should know better by now. Story 72. Taking an ambulance to the emergency room does not mean you will be seen immediately. You will be evaluated by a triage nurse and assigned to an area based on your condition. Patients with more serious conditions will be treated before you, regardless of how or when they arrive. Story 73. For parents. Toddlers and children can drink cow's milk, and in Canada it is promoted as part of a healthy diet. However, drinking large amounts can cause severe anemia, and cow's milk should not be the main source of nutrition. Story 74. Some say that autism has many similarities to borderline personality disorder. No, it does not. Schizoid personality disorder might be similar, but nobody screens for it. Story 75. The number of people I run into who think we leave a needle in your arm when you have an intravenous line is astonishing. Story 76. You can take medicine to get ahead of the cold I'm getting. Story 77. Just because you were vaccinated and still got the flu does not mean the vaccine failed. Story 78. My doctor said the prescription would be ready. Your doctor does not work here. Story 79. A nosebleed is not a sign of impending doom. Almost always, it is not serious. Story 80. A headache is cured by drilling a hole in the head to let the demons out. Story 81. Hospice does not kill people. Your terminal illness is killing you. We are here to make that death comfortable. Story 82. Autism does not mean no empathy. I have family, friends, and clients with autism. I may have it myself, though my doctors disagree. I see autistic people with low empathy and others with high or excessive empathy. I also see mutual lack of empathy, where neither autistic nor non-autistic people can empathize with the other because they are different. I see people who are so sensitive to another person's feelings that it seems like a sixth sense. I see people, especially women with autism, who are highly empathetic. They feel everyone else's pain, want to help, and may be clumsy in expressing it because they are overwhelmed, not underwhelmed. Story 83. A colleague who believes conspiracy theories told me that taking a spoonful of cinnamon every day would cure my type 1 diabetes and allow me to stop taking insulin. Story 84. The first time I heard that, I tried to explain that table salt does not even contain carbon, so how could it turn into fat? I was met with blank stares. Story 85. Many people think organ donation is quick and only for patients who are brain dead. There are two types of donation: donation after brain death and donation after cardiac death. Most people are unfamiliar with donation after cardiac death, and being involved can be very distressing. Story 86. X-rays are not dangerous nowadays. Everything is digital, and the exposure is so low that we do not even need a lead apron over patients. You receive more radiation exposure from the sun, from eating 2 bananas, or from flying in an airplane. Story 87. Not directly related to my work, but the idea that we only use 10% of our brain drives me nuts. Use that 10% to read a book instead of parroting bad science fiction. Story 88. Unless you are severely malnourished, taking extra vitamin C when you start to get sick will not help. It does not prevent colds, nor does it help your body fight them off faster. While regular intake of vitamin C supports overall immune health, products like Emergen-C do not provide additional benefit. Story 89. There is no needle in your arm when you have an intravenous line. It is like a little Capri Sun straw. Story 90. Shock is when the body cannot adequately perfuse the organs due to blood loss, sepsis, or other causes. You are not going into shock because a minor injury hurts. Pain is unlikely to kill you. Story 91. It did not drive me nuts, but in the intro to the show Scrubs during the theme I'm No Superman, John Dorian hangs the chest radiograph backwards. The heart appears on the wrong side. Either John Dorian hung it incorrectly, or the patient has the rare congenital condition situs inversus, in which the major visceral organs are in a mirror image position on the opposite side. Story 92. People who think the flu shot helps with the stomach flu. Story 93. Some believe that once someone's heartbeat returns after cardiopulmonary resuscitation, everything is fine. Sometimes that is true, but usually the patient has a severe anoxic brain injury. Some people view withdrawing life support as choosing to kill a family member. I understand why, but in many cases the person is already dying or in a condition that will only worsen. Life support is merely prolonging the dying process. Story 94. Marijuana is not good for post-traumatic stress disorder. This is the bane of my existence. Story 95. The claim that cranberry juice will fully prevent urinary tract infections is false. They usually mean cranberry juice cocktail, which contains very little actual cranberry. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.